Assalamu alaikum and good afternoon from Malaysia.
Walaikum Assalam.
This is the time to start our session on preparation and delivery of a problem-based learning session. And welcome to all to this second workshop of MedEd webinar series. We actually got more than expected response, in fact, an overwhelming response for people to join this workshop. Some of the institutions wanted the whole of their staff to join this workshop, but obviously we can entertain only a limited number of participants. So we have decided to conduct this workshop again for those who couldn't join this session today. Thank you very much for your cooperation and joining this workshop. Now, if you remember, I had conducted a questionnaire survey about the participants. I received 36 responses, and here we can see the wide range of academic staff joining this workshop. Let's say lecturers, senior registrars, assistant professors, professors at all levels. The academic staff is among the participants, and that is good because that makes the discussion rich, and we can share experience with each other. Obviously, this is not a teaching session. This is an experience sharing session. So I hope to get your active participation and sharing your experience, and any issues or problems, if you have, we can discuss that. Next was the question about the experience in problem-based learning. And again, we have all the four categories. There are people who have 25% who have actually conducted the PBL sessions before, so they are quite experienced in that. Another 22% have attended the PBL sessions. However, there is a quite significant number of participants who are not familiar with the problem-based learning. So this means that this session should cater for all levels of exposure and experience. And that's what we will try to do, so that we can address the needs of everyone participating in this workshop. Now, what are the learning outcomes which we wish to achieve in this workshop? The first one is that the participants should be able to, or will be able to, explain the concept of problem-based learning. What is the learning theory behind that? And the second is to discuss the roles of students and facilitators. That's very, very important area, because without knowing the roles of facilitator, the chairperson, the scribe, and the students, the session cannot be conducted successfully. And finally, we hope to achieve that the participants will be able to conduct a PBL session efficiently and effectively, more so by following the prescribed process and by following the stipulated rules. So let me explain the plan of this workshop. So first, there would be an interactive session by Professor Dr. Rukhsana Hossain Malik. And after that, we will divide all the participants into 4 groups. There would be breakout rooms, and this would be for hands-on session. And then the participants would go into their respective breakout rooms, and the target would be to identify the learning needs based on the trigger, which will be shared with all of you in due course of time. And also after this session, before we go out to breakout room, I will explain the whole process in detail so that we can run the session smoothly. And once the breakout room sessions are complete, we will come back to our main menu, and then we will have the presentations by all the 4 groups about the learning needs, what they have identified. And also we will request them to share their experience and the difficulties they face. And so we can discuss those areas in detail. And then, of course, there would be feedback, because Dr. Roxana and myself, we will be joining these breakout rooms off and on, and we will observe. And if there are any points which we will share with you in the form of feedback. So that is the briefing just before the session, but I will have a detailed briefing after the interactive session is over. Dr. Ruxana has a vast experience in conducting as well as organizing PBL sessions, and I'm sure that you will enjoy her presentation and will definitely learn some new points during that presentation. I'll hand over the session to Dr. Ruxana now. Thank you.
Assalamu alaikum and very good afternoon. Thank you very much for participating in this interactive session. As Prof. Malik has already briefed us, we are going to talk about the roles, responsibilities, and the process of the PBL. Okay, so he has already mentioned about the learning outcomes. So we move from here to the introduction to the learning. When we talk about the PBL actually is mainly a session which is used in universities and in the college levels, and it is meant for the adults to learn. There are some characteristics of the adults which are important, and for which the PBL is a very good way of making them learn the things instead of a didactic teaching. So it is the best approach to teaching is based on the knowledge of how the students learn, and student in medical schools, we say they are adults. So we need to know how the adults learn. Now there is a small introduction on it. So there is a dad who is reading the newspaper with the dog, and there is the sons who are talking with each other. The elder one says, I think Dad has taught the dog how to read. But the younger one says, but I don't see the dog reading. The elder one explains, I said Dad taught it. I didn't say that the dog learned it. So this is very important. What is more important, whether it was taught or if it was learned? And if we keep on teaching the students in the old tradition methods, and at the end of the day we say that the students are not learning anything, that means there is something wrong with the approach, and we have to make the students learn by another method which is more appropriate, which is more conducive, and which are going to help the students in gaining knowledge in a better way. And that method is the more interactive method, which includes PBL. There are many other ways of doing the interactive teaching with the students who are adults. Malcolm Knowles in 1968 came up with this adult learning theory, in which he explains that adults are independent and self-directed. That means that they can learn all by themselves. You just have to guide them how they are going to do all those things. Adults have accumulated a great deal of experience, which is a rich source of their learning, and they can utilize, and they should utilize their experiences to further their studies, to further their knowledge, and to further their requirements for the future. The adults value learning that integrates with the demand of their daily life. They wouldn't go for studying something which has no significance in their life, which is not going to give any improvement to their workplace or to their academics or their chances of being more successful. So practically the adults will do only those things in which they think that this is going to help them in their career. Adults are more interested in immediate and problem-centered approaches than in the subject-centered ones. So because of that, they have they want to do those things in which the results are very quick to come, and they can know that whether they have learned that thing or not. Adults are more motivated to learn by internal drives than the external drives. And the internal drives, if somebody wants to become a doctor, means that he would like to learn more things which is going to help you in him or her in their professions. And if you force them to do something else, it will not be possible to make them learn properly. The concept of problem-based learning is that it is a constructive, self-directed, collaborative, and contextual learning approach. It is constructive because the knowledge is constructed by the students. It is self-directed because that is done by themselves. It is collaborative because a group is involved in doing those activities. And it is contextual because it is according to the requirement of their learning stage at that time. And it is learned with the problem which they are facing. So it is contextual. Knowledge is socially constructed because it's a group activity under the guidance of a facilitator, who is a person who is going to guide them in the process, but is not going to give them any lectures or any material to study from, and then is going to assess them. It's not going to be anything like that. And the process of dealing with the authentic problem. The problems which are prepared for the PBL sessions are called as the PBL packages, and in those packages, the triggers which are taken from the real case scenarios from the hospital cases, which are modified slightly to cater to the need of the level of the students for which this package has been prepared. So the scenarios which are given to the students are from real life, they are from the hospitals, and they actually tell the students that this is what they are going to do, and this type of the patients are what they are going to see when they become the doctor. Students accept the ownership of the whole learning process because it is their responsibility to learn. So they have to take the ownership and responsibility for learning. As student becomes more involved in the learning process, PBL shows significant strength and enhances student learning outcomes. So normally what we say that students don't remember, or they remember only 20%. Their learning capacity is enhanced because they have learned all this from their internal drives, and they know why they are learning that. In the PBL, learning is not unidirectional. Like in the didactic section, the role of the facilitator is different from that of a teacher. How it is different? The members, everybody is the member of the team. They are not the leaders. Like you have the class teacher who always leads the class. Not a teacher, but a guide. The facilitator is just a guide, and there is a less control over the activities. The facilitator will intervene in the situations only when he thinks that there is something which is going to disrupt either the group teamwork, or they are going to disrupt the flow of of the discussion for any reason. So facilitator role is very specific in this one, and they are not going to teach the students by any ways or by any means. Sometimes it happens that during the PBL session with the very enthusiastic facilitators, they started giving lectures initially, but they had to be stopped from giving lectures or giving the information to the students. Neither they are supposed to give any sort of a written material or a printout material to the students to help them in learning. They are not there to help the students in that process. The information regarding that case and all the learning material is being searched by the students. We will be guiding them only on that, how they are going to get it. To run the PBL system successfully, we need more resources. It is a very resource-intensive methodology. For example, to teach 120 students, one lecture theater is enough, but to teach 120 students, you need at least 6 rooms. All those rooms should have some specific facilities. There will be 6 people who will be involved. The 6 facilitators we have to bring from somewhere, and that push the limits of the institutes a bit too much. But then at the end of the day, the PBLs are more effective and the learning is better. So the overall result is much better if you minus out from this the cost effectiveness of the process. Motivative teachers play the key role in the effective implementation of the program. It is very important that the teachers who are involved as in the role of a facilitator, they know their role over there, and they don't try to teach the students, and they are convinced that PBL is a good way of teaching to the students. If they are not, then probably the implementation of the PBLs becomes difficult. What are the facilitators' roles and responsibilities? We as PBL facilitators guide the students in the learning, elicit their higher order thinking, monitor the group dynamics, and challenge and motivate the students. I'm going to talk about them not in very much detail, but just give you a few points over there that how we do that. To guide the students in their learning, there are the procedural skills. Guide students step by step through the process. Ensure that the student approach the problem appropriately. Probe further, referring back questions. If they ask them the question, you refer back the question either to the group over there or ask them to comment, and that demonstrates the level of their understanding. Involve all students in the discussion. Ensure that the discussion is crisp and to the point, and the students are not wandering here and there. And if you see that the students have lost their concentration, you have to bring them into the group activity. Know when to tell and how much to tell. It is very important for the facilitator to know that how much information he or she can give and when. They comment on the quality of the argument which is presented. So they give the feedback to the students, help the students in setting the minimum learning needs which have already been identified when the PBL package was prepared, but the students don't know what was that minimum learning needs. So the facilitators keep a watch on that all the learning needs which have been identified in the PBL by the academic staff are met by the students. And the facilitator then will think himself not to be the boss over there, but only a member of the team who is going to guide the students. We elicit a higher order thinking. There are the attitudinal and behavioral skills, your commitment to the student-directed and lifelong learning procedures. That is very important, as I've said before, that the facilitator should be convinced that the student-directed learning is possible and students are capable of learning by themselves. Scaffold the learning, support the students to think by themselves. Encourage students to review and redefine explanations. If you think that they are talking about something which is not clear or which is vague, making connections to concept, principle, and processes. Nurture clinical reasoning through evaluating, analyzing, and informed decision-making by linking the theory to the practice. Encourage discussion of alternative perspectives. There are other ways of tackling to the problem, so you can ask them to come about and think that what other ways this issue can be resolved, opposing views, consequences, and conclusions. Challenge students' assumption ensures that a reflection and justify their assertions. How to challenge and motivate the students? There are the interpersonal skills, maintain the learner engagement in the PBL process, let students lead and make decisions to be responsible for high quality independent learning, and indicate when the depth and breadth has not been achieved by the students. You have to tell them that they have to learn more, they have to go into a greater depth. And that is only where after they have exhausted and they say they don't know anything else, then you have to prod and prompt them to tell them that there are other things in which they should also be reading about. Listen very attentively and actively to the students. You should look interested to the students that yes, you are also involved in the process. Ask open-ended questions to stimulate deep learning if they are doing the superficial learning over there. Encourage students to check for accuracy of information. If somebody says something so and you think that the information is not correct, you can ask the other students, do you agree with this thing? And if you agree, what is the evidence? Have you learned it? Do you know about it? All those sort of simple questions are going to motivate the students to do the deeper learning. Continuously evaluate and discuss their achievements. And evaluation doesn't mean that you give them the marks. Evaluation means that you give them the understanding that how much they have learned and how they can improve in their achievements. Recognize the high level performance or challenge the students to improve. The students who are doing well, you can say them good, very good, or you can say that you have been very productive. And you can ask the students who are not doing well how they can do well, and you can motivate them. Facilitate development of skills and each member's personal learning goals. In monitoring the group dynamics, the team building skills are very important. Set clear goals at the beginning of the session. Generally, it is done at a very early stage as soon as the student join the university. If it is a PBL learning curriculum and the PBL is introduced right from the day one of the course, then you have to tell them, set those goals at the beginning during the introductory week. Maintain the discipline by setting and implementing the ground rules, and act as a gatekeeper and timetable. Help in consensual decision making of the students. If the students get lost, then you can assist them in how to reach the consensus. Encourage group interaction, reinforcement, and agreement, and create a supportive climate. Encourage involvement of all. You will find that there are some students who will not be involved, will not be interested. So you have to bring them into the folds without belittling them and without making them annoyed that why are you asking them to do something. So practically, you have to bring them into the folds politely and encourage them to be part of the team. Monitor sharing of workload, prevent the dominance of the students. Everybody should be participating, the whole members, the number of students who are involved in that group, each and every person should be contributing in the discussion. And if they don't, then you have to, there are ways and means we will discuss later in which you can bring them into the folds and ask them to participate. Control of conflicting situations for team management. If you see there is a rift in the classroom, in the group, and the students are not gelling properly, then you have to do some measures. You have to take some measures to make the group function. Address the group problems when they arise involving concerned staff members. The responsibility of the facilitator is to be familiar with the learning objectives of the course, the module, and to go through the PBL package. The PBL package is given to the facilitator about a week before the start of the PBL session. And a day before the PBL session, they have to meet and discuss that PBL package. So practically, the facilitator, no matter from which department he or she is, they have to read the whole package, and the learning material is provided in that package for them to understand, because almost everybody is a doctor over there. So they have learned those things. They might have forgotten while they were doing their own post-graduations and things like that. So to refresh their knowledge, the PBL package contains the learning material for them, which is not obligatory for them to read all those materials from the PBL package. They can do their own self-study to understand that. Introduce the trigger at specific juncture to the students. It is the responsibility of the facilitator to pass those triggers to the chairperson, and the chairperson then distributes it to the group members. Assist the students in identifying the resource materials. A list of resource materials is provided in the package that this is given to the students, which is very precise and very latest information is given in that list. That list is given to the students, but again, the students are not obliged to follow those lists. They have their own methods of finding the information. They can search through that. Focus on the process, ensuring that no step is missed. Sometimes the students act smart and they shortcut number of steps in the PBL. Don't allow that, and make sure that each and every step of the PBL process is adhered to. Ensure that the minimum learning outcomes which have been identified are met with. Maintain the discipline with friendly cooperative atmosphere. Atmosphere maintenance is very important, because if the atmosphere of the group becomes toxic, then many of the students will not be participating in the PBL. Consult course coordinator regarding students' performance issues as early as possible. If you think that you are not able to manage the students, a student who is, say, shy, who is dominant, who looks uninterested, who looks sick or whatever, you can talk about that with the course coordinator and give your feedback to them before it is too late to salvage that person. Comply with the facilitator evaluation form, which is given over there. And the facilitator evaluates each student at the end of each PBL. You have to evaluate them, and for that you have to follow the process which is given for that evaluation. Evaluation forms are independently developed by different universities. There is no fixed pattern of them, but usually they contains the generally important questions which is going to help in the students' learning process. Give regular and constructive feedback to the students. There and then, just after the session, you can go give them that feedback and solve any administrative problems which arise during your tenure as a facilitator. Try to solve it as quickly as possible. The facilitator dilemmas. The facilitators undergo at some stages some problems. So how to cater to that? What if students learn their own bit? What happens is that after the PBL has been discussed, students normally divide the learning needs among themselves. And when they divide it among themselves, practically they go back and they read only their component. For example, this is a case of a heart attack, and the learning need is to read about the blood vessels of the heart, and one student take the responsibility that he will come prepared with that. He will read about it and he will share his knowledge with other group members, so the other people think that they don't have to read the blood supply of the heart. In that way, the students' knowledge will be deficient in the number of subjects, because they will be reading only their bit, which is wrong. So what to do at that time? Focus on discussion, not on the presentations. Don't ask the students to make the presentations. The students will be discussing the topic. Secondly, the must know and the good to know learning needs have to be identified. So when you go through the process, you will see that the must know topics is everybody must know it, and the good to know is those topics which are for the interest sake, and the one person can go and divide it. So don't let the students divide and rule in the PBL sessions. Randomly ask students to start a discussion. Normally they have a agreement with themselves that who will do what, and the chairperson is even involved in that process, and he will specifically ask the person who has prepared that specific topic to start with it. You can stop them and you can ask another person to start with that topic, so that they know that they can be caught off guard as well. Encourage the group involvement. Ask others to contribute. After somebody has discussed it, then ask somebody else to, if they have anything else to contribute. What is your idea about it? Share your understanding. Please summarize. You can ask them in different ways. If the students even don't say anything, you can ask the students to repeat what the other person has already said. The length and complexity of the problem from the administration side is to be controlled, because of too big a PBL package with too many learning needs and too many situations involved. Usually students are not happy with that, and then they will stop learning about it. And they, of course, then they will divide the topic. How to bring a missing learning outcome. So there is while they have discussed, they have gone to the end of the package and they are missing one of the learning outcomes. What to do now? Don't hasten, don't rush, probe them to think, suggest that all ideas are welcome. Normally the students think that this thing is important, but they will think that if that is not important, then that other people will laugh on me or they will make fun of me. Make sure that the students speak their minds, whatever is in their mind, encourage them to speak it, so that even if that thing has nothing to do with the people, still they can bring up that idea. Sometimes they come up with brilliant ideas as well. Ask questions rather than making statements. Don't tell them, ask them the questions about those learning outcomes. Should facilitator answer a question? Another very important thing, the students will be discussing something and they will start looking towards you and they will think that you are going to give them the answer to that question. Don't fall into that trap. Don't provide the direct answer and direct the question to the floor. Ask the other people in the group. Sorry. Okay. Information is, if the information is crucial for the continuation of the process, and you will think that if you don't tell them, they are going to be stuck over there, then you can hint it only, and then they will they go back onto the track. Take a pause and ask student to explore. Sometimes you can ask in the middle of the PBL system that we are taking the time off, open your books and look at this thing. You are given 5 minutes, and in that 5 minutes, they will collect the information and then they can come back. Should facilitator ask a question? Yes, you can if you want to stimulate the discussion, to provoke the students, but not to assess their knowledge. This is not the examination time. You are not assessing the student, and don't make them feel that you are asking them the question to see whether I'm knowledgeable or not. It's not like that. Keep the ground focused to achieve the objectives. Enhance the reasoning skills, like what is the rationale. Direct towards the missing learning outcomes to the students, that they have missed something. Do you think you have missed something? Can we think of some other alternative? Something like that will bring the student back on track. How to clarify the wrong concept? Ask provoking questions. Ask student to explore these as their learning issues, or guide them to the appropriate resources. What if you don't know the answer? Doesn't matter. Facilitators are not expert of all the disciplines. You can answer all the questions of your subject, but when the other subjects come, you might be mom and you won't be able to answer. So it's not your job to answer the questions. Ask them to read. Don't but you yourself should read the facilitator guide, because facilitator guide provides you a lot of information over there. Don't hasten to acknowledge you don't know. Don't hesitate to acknowledge that you don't know or you have forgotten. Be a part of the team and search for the answer together if required. It is not your responsibility, but sometimes you think that this is a new thing. The student has come up with a new idea, whether it is relevant or not. So let's search about it together. That will make the learning fun for the students. Direct to the students to the discipline experts. They can go to the discipline experts and clarify their issues after the PBL session, before coming for the next session. When it is necessary to intervene, when there is an apathy or lack of meaningful interaction in the group, where there is a limited or focus or a very lengthy discussion which is not going anywhere and they're going round and round, when there is a disrupting group member in the team, when there is a forgotten student, and when there is a dominating students. These are very difficult situations to take care of, especially the forgotten students, the dominating students, and the disruptive group members. They have very strong personalities, and they are adamant in continue doing what they are doing. So you have to be very technically vigilant in going in making them involved in the group discussion, and to be a better member of the team by involving the other students or involving the staff or the staffs as well. How to manage a quiet student now? Request other students to engage them in discussion. Ask them to summarize the discussion after the discussion has done and they have not opened their mouth. You can ask them to summarize it. Encourage them to share their ideas. Sometimes the students are not able to reply because of the language problem. You know that to speak English is not an easy thing to do. Once you can translate your language into English and then you speak it loudly. And by the time the student is able to speak it loudly, that thing has already been said by somebody else. So the student ultimately starts to lose interest in even making those sentences in their brain. Although they might be knowing everything, but they are not able to share those ideas. So give them time to pause. You have asked somebody, let him think about it, and then he or she can give the answer. So you have to be patient over there. Don't give feedback in a hurry. Arrange a meeting with the students. Call the student to your office, talk to them, ask them what is the problem, and then you can help those students. How to manage a dominant student. Now, dominant students usually are very, very good students of the class. If you stop them altogether, then they will withdraw from the group and they will not participate. And if they are not going to participate, practically it is the loss for the whole class as well. So it's very important that they are there over there, but they are not dominating all the time. So ask them that there is a time pressure. Tell them that everybody should get a chance to speak. You can ask the student to start the topic, their discussion one by one. Engage the chairperson to involve all the students over there. Ask all students to give feedback about their or the others. While they're giving that feedback, the dominant students will definitely or should be identified by the other members, and you can give that feedback to the dominant member. Have the personal discussion with the students. You can call him or her in your office, and you can tell them the problem which is being created because of his dominance. Now we go to the next stage, the students' role and responsibilities. The role of the students are three. They have to be a chairperson, they have to be a scribe, and they have to be the members of the group. Everybody is the member of the group, but the chairperson and the scribe has more specific roles also. That means that the chairperson and scribe also have to contribute in the discussion because they are the member of the group as well. So they don't have to act the chairperson all the time. One student in group will act as a chair for one PBL case. All should aim to chair a session for at least one case. Normally, if the PBL is being conducted in the class every week, like in some of the universities over here, it is a routine to have a PBL session every week. A PBL session is introduced on Monday and it is discussed on Friday, and next Monday then another PBL is introduced. In that case, a chairperson will be changed after every week. One PBL is over, during the next PBL, another person will be the chairperson. The reason of rotating is that in that way, everybody gets the opportunity to lead the group, and that will help in developing them the leadership qualities. The chairperson will assist in organization of each session, ensures that the ground rules are followed, example, punctuality and discipline. If now there is another person who is responsible to take care of your job also, that the ground rules are being followed. invite participation by all, summarize the point at important junctures and ask others, contributes in consensual agreement on learning issues, provide positive reinforcement and encouragement to his colleagues, and avoid always talking first and at length. Normally, when you become a chairperson, then you start talking, and then sometimes you keep on talking and talking. So technically, that is a bad communication, and that bad communication skills should be curbed right in the student stage of the students. Help to maintain the group dynamics, foster respect and good communication among the students. Everybody has the right of expression, so nobody can stop other students from expressing, and they have to be patient. So this is the responsibility of the chair to do it. What if chairman becomes absent? Okay, we'll discuss these things when we are finished, and you will know about it. Okay. Help to maintain the group dynamics, foster respect and good communication. Everybody has the right of expression and avoid conflicts among the students. Usually there will happen some very minor conflicts among the students, which especially the girls take very, very seriously. They are roommates and they are fighting, and when they are fighting in the room, they are also fighting over here in the PBL session. So you have to be very careful about the human behavior over here. Try to manage dominant and the lost members. That's a chairperson. Okay. Okay. As a scribe or the recorder, one of the students in the PBL group acts as a scribe for one PBL case, working closely with the chairperson. The job of that person is practically to write down everything on the whiteboard or on the flip charts or blackboard, whatever medium you are using. All the discussion points, but for that there is a specific format in which the students are asked to do this process. You can see over there that they will first discuss the difficult terms and their meanings, then they will talk about the facts which are given in the trigger and the ideas about it. Then they explore those ideas and say they are the explanation of the facts, and they come up with a hypothesis. That is very important, that students have come to the conclusion that this is what they suspect the patient is having. And then if they know what whatever learning needs they have identified, some of them they would already know, some of them they won't know, which they don't know, they will make it as their learning needs. So the role of the scribe is to record key discussion points legibly on the flip chart or on the blackboard. Ask for clarification with members to ensure that they keep on asking, am I writing it correct? Is there anything which I have left? So because sometimes it happens that during discussion there are 3 or 4 people they are talking, and it is very difficult for the scribe to understand which one is the final decision, whether it should be or it should not be included. So they can ask for that, record the learning needs and circulate them to the members if asked. Normally what happens is that once the PBL, the learning needs have been identified, everybody now has the handphone and they can take the picture of that. But previously, when we didn't have the phone with all the members, we used to ask them to circulate it. The person will make the copies of those learning needs, and then they will give it to its students, or keep the list of learning issues or needs identified. If the group has their own dedicated PBL room, in that case, those learning outcomes which have been identified and all those discussion remains on the blackboard or the flip chart in that room, and when they come for the second session, they can they can go through them and they can see how much they have done and what they have missed. All the information of the previous discussion stays over there. Otherwise, they have to take the picture. Link the scribe. Then between the 2 PBL formal sessions, there is an informal session in which the students have to meet, they have to study. they have to come over there, they have to discuss, and they have to come up with the conclusion that yes, now they have understood all the PBL. In that case, the scribe has to be present over there in that session as well. Act as a channel for communication between sessions. He or she will take the notes of that discussion as well, ensure that the writing material is available, involve in discussion, and help in the identification of the learning needs. As a group member, participates as well. So practically the scribe is doing the double job. He or she is writing for the other students as well, making sure that everything which is discussed is there, written black and white, and they are also contributing. They are also giving their ideas and their thoughts. As a member, the professional behavior, communication skills, speak directly to the group with easy flow and eye contact. Don't be overwhelming. Don't be over projecting. The communication skills should be in a very humble way. Identify misunderstanding and attempt to resolve it as early as possible because the group becomes too dysfunctional. Recognize and respond to non-verbal communications. This is the normal requirement of the good communication skills, technically. Attitude and behavior, neither be rude, arrogant, nor patronizing. Allow others to express their opinion and share information. Acknowledge contributions, say thank you, and apologize for shortcomings when you are not able to bring up all those information. You're not able to contribute, then you can say sorry to the group. Be punctual and complete the assigned task and negotiate the alternatives. If you are not able to come, for example, a student has decided to come prepared with a small chunk of the information and is not coming, and that is very important learning need, then negotiate. He should negotiate the alternative and ask somebody else to come prepared with that information. Self-awareness and self-evaluation is very important. Difficulty in understanding and lack of appropriate knowledge usually is the students. If they have these problems, they should appreciate this thing earlier on so that they know that they are having a problem and how they are going to tackle it. Otherwise, by the end of the semester or by the end of the year, they wouldn't know many things. Discomfort in discussing or dealing with a particular issue, they have to overcome these things. Respond to fear negative evaluation without being defensive, and be aware of the situated cognition. Situated cognition is a very, very important component of the PBL. It means that you are learning what you have to learn within the community, for the community. For example, if the PBL is being made for the people in UK, that PBL package will not be 100% safe to be used, say, in Pakistan or in Bangladesh or in Malaysia or anywhere else, because there are different cultural values over there. So whatever they are learning and how they are learning and how they are developing themselves, both as an individual and as a good learner, knowledgeable learner, they have to be aware of the cultural requirements of the community. As a member, they should be learning to learn. Independent learning, assume high degree of responsibility for your own learning. That is what the STL is all about. Actively search for the answers, share information with the group. Now, sometimes it happens that the people who are the good students, they will read everything, but when the discussion time comes, they will not open their mouth. Because they said, we have spent so much time in learning this thing, why should I share when nobody else come prepared? So there is no competition going on over there. Everybody should share their information with the group. Create and recreate knowledge for deeper understanding. Monitor the personal contributions and reflect on the input of each and every student. Team learning. Participate actively in the discussion by responding or expanding the relevant issues. You have more information. You can discuss further beyond that boundary as well. Help setting the relevant learning needs for self and group. Work on all the learning needs. Please, it is very important to understand that work on all the learning needs, either alone or with friends, which might not be your group members. You have a different friend group, which are not with you in the PBL group. So you can discuss with them, and you can complete your knowledge, or you can complete your understanding by discussing the things with them as well. Develop flexible lifelong learning skills, which is very important. As a member, there should be a collaborative learning. Interpersonal and collaboration skills are very important. Learn to work together and support each other. Control the tendency to dominate or reluctance to speak. Think how behavior affects a group activity and achievements. Give contribution during in-between activities of the group. So practically the students have to be really working for each other to achieve the targets. During face-to-face interaction and positive interdependence, recognize the value of individual difference and support that. Some people are the way of communicating, the way of expressing themselves, everybody is different. So you have to familiarize yourself with that, and be friendly with each other. Challenge each other respectfully, and don't agree for agreeing. Normally it happens that when a student says something, the other students will second them without thinking that whatever he said is wrong or right or whatever. So it will lead to complacency. So don't agree for the sake of agreeing. Individual responsibility and group interaction processing. Exhibit friendly and cooperative attitude towards other. Be sensitive to religious and cultural issues. It is very important in those places where we have a multi-religious, multicultural type of a society, and we cannot speak of few things which are accepted by one religion but which are not accepted by another religion. Normally that type of PBL packages are not produced, but if the issue come in during the discussion, the students should know how to tackle it. Generally, the students who are living in this society, they are aware of all these things. Identify misunderstandings and attempt to resolve it. Evaluate your effectiveness and skills, improving self-awareness. So this is all the things which are happening between students and students. The responsibility of the students is to be prepared for the PBL, goal-oriented and internally motivated, shoulder the accountability, follow the ground rules, actively participate, identify and analyze problem and generate hypotheses, ask questions, be inquisitive, look for answers, resolve resources to refine understanding. This asking question is among the group itself. So please make sure that they are not asking the question to the facilitators. The questioning part is done between the students, so they ask themselves from each other to get the clarifications done. Share information, work together and come prepared. Link theory to practice, very important. Correlate with the trigger patient. Many a time it happens that while discussing the things, that the students forget that they have a paper in which there was a patient problem was there. So it is very important that they should go back to that patient, read the trigger again during the session and see whether whatever they are learning is correlating with this patient's problem or not. Make decisions, take responsibility for learning. Foster professional attitude, competence, and confidence. Emulate interdisciplinary team processes as in real situation, and have fun while learning by sharing your experiences. The group dilemmas are, again, small group dysfunction. This is a small group. What to do? Students are unprepared, they come late, or they are absent from sessions. They are quite shy students, rarely contribute to discussion. They are called as the free riders. There are dominant students who try to control discussion, don't let other people talk, and there might be a personality clash between the students in the group. So all these things are important factors which cause the team to be dysfunctional. Lack of commitment, apathy, or lack of meaningful interaction among the group keeps on storming, and there's a superficial study going on, and they're not thinking, they're not trying to correlate, they're not trying to understand the problem properly. There are disorganized clinical reasoning process. They are not thinking in the steps of the Bloom's taxonomy. The students feel little psychosocial aspect of the case. Usually there is a psychosocial aspect of the case always given with the PBL to for example, if the patient is poor, then you cannot ask that during the investigation stage. You are going to ask them to get them MRI done all the time. So practically, you have to be careful about those things. Shortcuts the duration of session and rushes through the activity. This is a very common problem, that the students shortcut the duration of session. Normally, the duration of the session is 2 hours. The 1 hour after that session is left empty. It's the STL time in the timetable, and that time sometimes the discussion time overspills and the students can go to that time. That is why it is left empty. That slot is always left empty. But sometimes the students, the 2 hours they finish in 1 hour and they think that they have done a wonderful job. That is not because they have not discussed the problem properly. So don't allow them as a facilitator to shortcut these things. The students also have problems with the facilitators. They should think that should all facilitators be medically qualified. There are some facilitators who have done the PhDs. Some are medically qualified. The medically qualified would have a generally wider knowledge of different subjects, while the person who has done the PhD will have more knowledge about his or her subject. So that can cause some confusion among the students. But it is not necessary that all the students, all the facilitators should be medically qualified. They have been provided with the guidebook and they can read through, and of course they are adults, they can understand that much of physiology or biochemistry, which is given in detail to the facilitators. So all faculty members can bring in their experience and their perspective into it. All should be trained to be facilitators, and they know the process of the facilitation. The facilitation training is important, and all the facilitators are trained. We'll talk about them in a while. Should facilitator provide all the triggers to student before the session to complete it? Now, what happens is, as the facilitators have the PBL package and they have access to the triggers, the session is on Monday, they will give the PBL, the triggers to the student on the previous Friday, and ask the student to come prepared with that. That will short circuit the whole process of the PBL. And the students, the PBL practically is not as important for knowledge gaining than to develop some skills among the students. That includes the communication skills, that includes the taking the responsibility, the discussion, the involvement, the process, how to work on the thing, the critical thinking, the reasoning skills, all that. If they have done this work individually, sitting in their rooms, and come with all the ready-made answers during the PBL session, that defeats the whole purpose of the PBL. So we should completely avoid, the facilitator should completely avoid giving the triggers. And if somebody has given, practically the students should inform the administration about it. How should student react to mini lecture by facilitators? Again, because we are expert in one of the subjects, many a time it happened that when the facilitated training was not done that efficiently at times. But nowadays, for example, in Malaysia, every facilitator has to be a trained facilitator. And in that, one very important thing is that you are not going to give any mini lecture to the students. The facilitator will come in the class. The case is about the cardiac heart attack. He will tell them the whole story. He will tell them everything, and then he will take a sigh of relief that yes, parted the information to all the students. Then he will normally sit over there and snore when the students are working on it. That is a very, very wrong attitude, and it should not be encouraged. Is there a standard format for facilitators to follow? Why different facilitators conduct PBL in different ways? So some facilitators are labeled as very friendly. Some facilitators are labeled as being very tough. They will not let us divide the topic among ourselves, all those things. The main important thing is that it is the students who conduct the sessions, not the facilitators. Facilitators are crucial in facilitating the learning process, and they have different styles of doing so. The session itself is the student-directed session. Dilemma with the individual students. Quiet students find their area of expertise and consult them to get opinion. Give them time to answer, listen to it, and value their contributions. Ask questions before the start of session. Confront non-practicing students in a non-judgmental way. Dominating students make a ground rule that everyone talks on turn. Rotating the chairperson role among the students also will help the dominating student to the other persons to control the dominating students. Every students get equal opportunity to be heard, asking them to listen to other without interrupting, and set times for each contribution. Sometimes it is done, but normally it is not very practicable because the students have their own flow, and some students try to explain the things in a slightly more detail, but there should be some limitation or some check and balance about how much time each student is taking. The disruptive students, assign them responsibilities and ask for contributions. Find their area of interest and involve them in decision making. Make them feel important. That is very important. That if you make them feel important, that they will know that they have the role in the group as well. The process of the PBL, we have completed the roles of the students and the roles of the facilitators, and a bit of the introduction on the PBL itself. Now the last part is the process of the PBL. The general organization is that the students are divided into small groups. 7 to 11 is the number. It's not a magical number. Some people think that the 7 is the 5 is okay. Generally, we think that 5 is too less to develop the team. The team as to the students to work as a team. Each PBL group has its own room, which is equipped with round table and shared locker to keep books. Some of the medical schools give projection facilities as well. Each PBL has a minimum of 2 sessions with at least one independent study period in between, and some PBLs have several sessions. A gap of at least 1 day between the 2 sessions is required. One facilitator is assigned per group for one or more rowing between 2 or more groups. Facilitators should not change during PBL. It is very important the facilitator which is assigned to one group should not change during one PBL, which is of for those 2 days. In between, if the facilitator has something else, make sure that on the day of the facilitation, he or she should not disappear. Once in a while, if that happens, it's an emergency. That is fine. That we always have the reserve facilitators in our list. So we assign that person to that and to do that job, and he also is the person who will be contributing in the discussion meeting of the facilitators as well. So those people are involved in all the process from the very beginning, so they will take over, but this situation should be avoided as much as possible. Facilitator is assigned to a group for ample time to develop a strong functional team, example for a module or for a term. If the PBLs are conducted every week, so there will be 1 week will be enough, or if they are conducted once a week it's a module is 7 weeks, so they have interaction with each other for 7 times. That will develop the good teamwork. Attending workshop on facilitation skill and sitting in for at least 2 PBL is the prerequisite of the facilitator. First, they have to attend the workshop, then they have to sit for at least 2 PBLs. That means that all 4 sessions altogether. Facilitator meeting is held a few days prior to session to understand the case and to strategize the input. Preparing the students for PBL, conduct an interactive session and workshop on PBL. The objective of the PBL, the process, the knowledge, skill, and the attitude all are emphasized to the students, what they're supposed to do in the PBL. The ice-breaking session will take place again during the introductory week of the students. In which each PBL facilitator will meet with their group. The main purpose is to get to know each other, to reduce the anxieties, to develop group dynamics, and regard and respect for each other. So they will ask, the students will ask what, why, when, what if, all those type of questions during that time to be more familiarized with the PBLs. The ground rules are also developed during this session that will clarify the group's expectations and the transferable skills, the time management and teamwork, and make all group members responsible. The PBL process is conducted as in 7 steps. This is the flow. The exploration of the problem. The first, when the problem is given to the students, they will read through it to clarify all the term, and if they don't understand any term, they will find out the meaning of it. Then they will identify the key problems which are given in those triggers. What are those issues? Then they will generate the ideas about those problems, what they know about this problem, how much they know, whether their knowledge is enough or not, or whether they need to read the book. And they will brainstorm for all those explanations, and then they will come up with their hypothesis. They will arrange each explanation into conclusion or hypothesis, and then they will formulate the learning needs out of those hypotheses, that this is the knowledge which they are missing, which they don't know, which they need to learn in more depth. Sometimes after the brainstorming, they have not come up with the good hypothesis, so they can go back to the brainstorming component again, and then they can come up with the hypothesis when they really think that they know exactly what the patient is suffering from. The formulation of the learning needs, then they will after they have formulated the learning needs, they will go for search of the resources and do self or group studies and further discussion and case closure. If there's a 2-session PBL, then they will go for the case closure in the second session. But sometimes there are more than one trigger which are given in the first week. So they go through this process and then they go back to the second trigger also, and they will identify the learning needs over there also. And then they will discuss the whole 2 triggers in the second session. Lastly, they will evaluate the group performance, self-evaluation, the reflection to be done. The process of PBL, the clarification of term is to understand the trigger. Student read the written scenario or the problem, identify the difficult terms and find their meanings, and understand the scientific terminology which is used. The key information is then they will find out from the problem, discuss the complaint and or issues, list the identified facts and problems, and prioritize the problem or issues for the learning purposes. Sometimes in the PBL packages, the information which is given is what, like when during the history taking, the patient tells you so many things. Most of those things might not be relevant to the diagnosis of the disease that patient is suffering from. Similarly, sometimes the trigger has some information which is not relevant, but the students should learn how to filter those informations out. Then they will go for the brainstorming part, in which they will discuss each and every aspect, which the ideas which they have come up. They will talk about them, and for that they will activate their prior knowledge and find out the gaps in that. That will require the critical analysis through self-study and discussion with peers and responding to questions. Motivational processes, they support these sort of cognitive changes. Require active discussion and involvement of all biological, psychological, and social aspects of the problems that is also discussed. The local context, legal and ethical issues related to the problem are also discussed if they are important in that PBL scenario. And then at the end of the day, they have to develop the concept maps as well. The concept maps actually really guide the student that what they have learned is what the flow of all the activity is. Hypothesis generation is the inquiry process involves asking, probing, analyzing, and comparing the data and transferring the data into concepts that will generate the correct hypothesis, that what actually they think the patient has problem with. The data is disorganized. If the data is disorganized or incomplete, facilitator asked to review and resynthesize the facts, and then they have to go through this process again. As the additional information is provided, as I've told you, sometimes the student can amend the hypothesis of the previous trigger. Without hypothesis, students collect unfocused data, leading to discrepancies, confusions, and misunderstanding. Identification of the learning needs. Prioritize into must know. Those learning needs are then prioritized into must know and good to know. The must know are the individual learning needs. Each and every student should learn about them, and the good to know are the group learning needs, in which, for example, there is a case of a burn, and one of the students thinks that he want to know how the burn centers work, so he can go to the hospital and look at the burn center and come back and give that information. For that thing, the whole of the group doesn't have to go to any hospital and to search for that information. Study revealed that 65% of learning needs identified by students and faculty they matched. Many non-intended learning needs generated by students were also thought to be relevant. Students phrase their learning needs as questions. All students study all learning needs. It is must in undergraduate, study 2 to 3 major learning needs, rest are distributed, or divide the learning needs among themselves. These are the 3 ways to do. But in undergraduate studies, it is very important that all the must know learning needs are done by all. Now, this is one example of the process of PBL. Suppose the clinical scenario given to the student is only this, that Majid is absent today because he has fever. Now everybody will think, what will be there about the fever that we can talk about? This is just no information given, nothing. The question arises, the students start thinking, what is fever? What is the normal? For they know this is a fever, then what is the normal body temperature? How body maintains its temperature? How do we measure the body temperature? Why we get fever? What are the common causes of fever? What is the mechanism of development of fever? How does fever affect our body? How we relieve fever? What drugs are used to treat fever? What is the likely cause of fever in Majid? Ultimately, go back to the patient and find out what is the likely cause in Majid. So this is how the learning process goes. That is how the critical thinking goes. The student thinks haywire, hit hodgepodge here and there, but in the process they keep on consolidating their learning and knowledge. The resource search and active learning is an important. Again, there is the situational interest hypothesis, which I've already discussed. Students work as team or individually and meet as group in between 2 sessions to discuss the learning needs. A list of resources is provided to the students. Students need to learn information processing skills, like how they can improve the short-term and the long-term memory. In the process, these things are probably taught in physiology lectures as well. Discussion presentation. The last part is the second session will be on discussion and presentation. Integrate the newly acquired knowledge into the context of problem through discussions, charts, diagrams, concept maps. They can bring in anything with them. Even sometimes they do bring in the anatomy models or the pathology specimens from the labs. Co-construct their knowledge through co-elaboration, how different they should have thought and analyzed the problem, develop strong reasoning and communication skills. Closure is to close the loose ends. After the discussion has been done, a small trigger is given to the students in which it is informed what happened to the patient next and how the patient was managed and what happened to the patient, how he was discharged, when he was asked to come back, and what are the drugs given to that patient, and all those information. That is to give the complete coverage of that patient, which they were discussing for the whole week. Probably they would know exactly what happened to that patient. The second component is not discussed because the PBL is considered as finished at this stage, but they can share that information among themselves, and they can ask the facilitator to assist them also. They can ask special request. The debriefing is done after the PBL, helps the students to evaluate both the process and the knowledge acquisition for reinforcement and constructive feedback of the student. When the PBL and the closure has been done, the facilitator will ask the students, each and every student, about what they think about their input, and the students, and he asked the students what they think is how he was facilitating the group. So it's a both ways, so they will both give feedbacks to each other. Mm, the characteristics will be the know their strengths, know their weaknesses, will help in their self-reflection. It is very important that we encourage the students to do self-reflection. Go back home and think whether what have you done with the PBL, and whether your participation in it was satisfactory to you or not. The students really get motivated by that, and they will think a lot about it. The component assessment of self-performance, both by the students and facilitators, group activity, student and facilitator, the assessment of the facilitator roles and the achievements and the behavior and all that, they will be assessed. Issues associated with the process, the exploration of problem and clarification of term, missed the steps and jump to next step, provide wrong explanation, expects the facilitators to explain. Please don't do that. Ask the students, motivate the student to talk. Identify key in the identification of the key learning issues, ill-defined problem or missed out important information. Generation of ideas and brainstorm explanation without critical reasoning, just discuss it very superficially, and then they will think that this is the problem. So they will leave everything to the facilitator ultimately. Arrange each explanation into conclusion and hypothesis, unable to see the pattern, unable to critically analyze, go back to the problem again and start discussing it again. Formulation of learning issues, questions formulation is vague and unfocused. That is why normally it is asked that they should formulate the question in the question form. So what, why, how, what they want to know actually. Search resources and self-study and self or group study problems with time management. Normally they read the text very superficially, get material from their seniors. It's one of the problems that, and the lack of commitment to the PBL process. Further discussion and case closure, exchange factual knowledge with no correlation with the case. They think that they are going to discuss all the anatomy and physiology and the biochemistry and the pathology of the patient, but they do not correlate it with the case. Why, how this thing fits into the case, how this thing fits into the presenting complaints of the patients. That part usually gets missed. So this thing should be avoided. Hesitant to challenge material shared by others, lack of motivation, and divide and rule strategy. Evaluation of the group performance, self-evaluation and reflection is very, very important. The superficial feedback sometimes is very superficial. They will say all is good when all is not good, everybody knows. Reluctant to say anything bad about their peers, it's another issue. Or they think it's time constraining and they cannot fulfill all those forms and all those things properly. Sorry. Lastly, just to share the PBL evaluation form. This is one of the forms which we use, but there are many different varieties of form which are used for each by each university, which create them by themselves. Thank you very much.
Thank you very much, Dr. Rukhsana. She has given us um, quite in detail about what is expected of a facilitator, what is expected of a chairperson, a student, and then going through the whole process of PBL and what are the likely issues and how to manage them. Now, because all the participants, you would be acting either as facilitator or a chairperson or a student during the hands-on session, which we are going to have now. So I think that referring to that presentation would help to play your role, the respective role. Right. Before we move forward, are there any questions for Dr. Rukhsana?
Okay, there's one question. Okay, this is one question by Sana. Sana, you have asked that, Madam, how can we conduct a PBL session for first year in basic sciences? Okay. What we have over here is that in the first year, the first module, which is about 3 months in duration, is to cover the basics of the basic sciences. So they will introduce the students to the basics of the anatomy, the physiology, and the biochemistry, pathology, for all the basic subjects, the basic and sciences and the clinical sciences subjects. The PBL is introduced when we go into the system-based modules. That is the second term modules. And in those modules, because they already have some knowledge about the heart, some knowledge about the blood vessels, some knowledge about the musculoskeletal system, all the systems, so they can pick up from there. They have something to scratch their head with. Also, there is the students have learned all those things in a slightly maybe a different way in their FSC as well. So practically, the PBL triggers are not extensively clinical. They will be integrated, and they will include all the basic science subjects in it. So that's very important, that you cannot have a PBL only on a physiology or on an anatomy or biochemistry like that. Integrated, but not too very clinical.
So there's another question.
Is there any weightage in final examination for these PBLs and SGS session? If not, then students usually do not. There is a weightage. They contribute marks. About 10% of the marks come from the PBL session. So it's a huge contribution of the PBLs in the final assessment. Yes. Yes, and the attendance is taken from these sessions. The lecture sessions attendance is not calculated. The attendance of the small group sessions, like the PBLs and the SGS and the lab sessions, all that is taken into account. And the requirement of the attendance is 90%. So practically they have to come for these PBLs.
All right, thank you very much. I think this is the time we move on to our next step, and that is that the what we are going to do next. So yeah, now after this interactive session, now I'm going to brief you about the next step, what we are going to do, which is the hands-on session. So and I have already sent a copy of this in your WhatsApp, so that whenever you need to refer, you can look back at that. So all the participants now will be divided into 4 groups or 4 breakout rooms. We have identified all the 4 facilitators. May I know whether they are here, are present? Is Dr. Hafsa Bibi present? Dr. Hafsa, can you hear me?
Yes, sir. Yes, sir. I'm here, sir.
Is Dr. Hafsa in the?
Yes, sir.
Is Dr. Hafsa present?
Yes, sir. I'm present, sir.
Yes, thank you. Dr. Uzma Siddiq?
Yes, sir, I'm present.
Right. And Dr. Saira Safdar?
Present, sir.
Good. And Dr. Munaza Basir?
Assalamu alaikum, sir. Yes, I'm present here.
All right. Thank you very much. So we have all the 4 facilitators present. Now, when we make these breakout rooms, and all the participants would go into the breakout rooms. The facilitators note, please don't join the breakout room. You will be assigned by the administrator that which group you will be going. So once the breakout rooms are formed and you are requested to join, all the participants would join except the facilitators. So once we are in the breakout rooms, what we are supposed to do is please keep your camera on and do not mute yourself. Facilitators, as I mentioned, have already been identified. And once every participant is in the breakout room, the facilitator would introduce herself. And then facilitator would invite all the participants to introduce themselves one by one. And then facilitator would ask the participants to choose a chairperson, right? So the role of chairperson has been explained quite in detail by Dr. Rukhsana, and that chairperson would be selected by the participants of the group. Then chairperson can nominate or can ask for a volunteer to be a scribe. And again, the role of scribe has been given in detail. Then participants will receive a trigger through WhatsApp. Normally, the trigger is given by the chairperson, but no, because we are doing online, and so that would not be possible for chairperson to distribute that. So we will send the trigger in the WhatsApp group, so everyone in the WhatsApp group will receive the trigger. And at this point, the scribe will share the whiteboard. If so, it's good to choose a scribe who is quite familiar with the use of this technology and Zoom and whiteboard. But the other alternative is that if you do not want to use the whiteboard, you can open a Word document, because as the role has been described, the scribe has to type a number of information on this document. Then chairperson will ask one of the participants to read the trigger loud. And then participants will identify the difficult words, and scribe would note those words on the document. And the participants would find meaning of those difficult words and identify if there are any learning needs related to those difficult words. And scribe would note those learning needs on the whiteboard or the document. Then participants will brainstorm on the trigger, and they would note any facts and phenomena and ideas. Just follow the table which as Dr. Rukhsana has shown in her presentation. So identifying the facts or phenomena and idea, and then try to explain that facts or that idea or that hypothesis, and that will help you to identify the gaps in your knowledge, and that gaps in knowledge will become the learning needs. So scribe would write these learning needs in that document. Then our scribe either would write in the document or would use that table and document these learning needs.
चादर खराब हुई
And
हुई है
once this is done,
बेडरूम
then
साफ करो मैं फहीम
everybody
के सामने नहीं आ
returns
सकती तो जाके उसका रूम को
to
साफ
main
करके आना
venue. I think we will give you about half an hour
मैं
to
क्लास
go
ले
through this whole exercise before you return to the main venue. And once you are back in the main venue, then scribes will present the identified learning needs for their groups. And then there would be discussion on these learning needs. And then there would be the feedback on that. And while you are working in your breakout rooms, Dr. Rukhsana and we will be visiting different rooms and observing if there are any issues related to that. Any questions so far before we move on to our next step? Anybody has any question?
Assalamu alaikum, sir. What is the time which is allowed for each group during the session?
Is the process clear to everybody?
Yes, sir.
Yeah, with the half an hour for this discussion. The breakout session would be for half an hour. Is there any other question? If none, then we will move
is there
on
any
to,
hard and sir, is there any
the,
hard and fast rule of number of the questions, discussion
the
questions
next
after
step?
the on the page?
That's the way I will make the breakout rooms, and everybody would join their breakout rooms except the facilitators. So please look at the list and join your breakout room, except the facilitators. Is there any question that I might have missed? Right? Okay. Everybody has joined. So okay. Dr. Hafsa, can you hear me? Dr. Hafsa, can you hear me?
Yes, sir. Sir, I can hear, sir.
Yeah, can you join the room 1, please? Dr. Saira, can you join the room 2, please?
Yes, sir.
All right. And Dr. Uzma, can you join room 3, please?
Sir, I have option for joining room 4. So how can I join room number 3?
Okay, you can join room number 4. Yeah, that's fine.
In my screen, this is displayed room number 4.
Right, okay.
Okay, sir.
All right, and then Dr. Uzma, Dr. Hafsa, you have joined. All the facilitators have joined.
Sir,
Yeah.
sir, I'm having the option to join room number 4.
No,
It's Dr. Hafsa. Dr. Hafsa, sir.
no, you Okay, you can change the room and you can join the other room.
And now I'm having the option room number 3.
Okay, now let me repeat. Dr. Hafsa, which room are you now?
Sir, I'm having the option to join room number 3. So should I join it?
So let me allot you the rooms. Dr. Hafsa goes to room number 1. Okay, Dr.
Okay,
Hafsa,
sir. Thank
right.
you.
Dr. Saira goes to room number 2. Right? Saira Saptagia. And Dr. Usma Siddiq goes to room number 3. Okay. Dr. Usma
Assalamu
Siddiq.
alaikum, sir.
Walaikum salam.
Sir, there was already Dr. Manasa present, so where should I go? Okay,
No,
option is there.
yeah, you are going to room 3.
Okay, thank you, sir.
Right.
Thank you.
And then Dr. Munaza is going to room 4. Okay, so everybody is in their rooms. पॉडकास्ट हो सकती है ना रूम्स में तो इसको तो Assalamu alaikum. I think everybody is in their rooms with the facilitators. You can please start the process. The facilitator can start the process by introducing herself and then by asking the participants to introduce one by one and then follow the sequence. Best of luck. नहीं अभी भेजना है
I think we should continue with the PBL session. First of all,
Assalamu alaikum.
Walaikum Salam, sir.
Walaikum salam, sir.
Is everything okay?
Yes, sir.
Yeah, and I have already sent the trigger in your WhatsApp group. And
Yes, sir.
yeah, and Dr. Hafsa, please, sorry to disturb you, but just continue.
Okay, sir. Thank you, sir. First of all, that what you want to do. I think
I'll
we
read the
are
scenario.
okay.
I'll
Thank
read
you,
the
Dr. Humaira. Please go
Okay.
ahead.
Mr. Chu, a 56-year-old businessman, comes to your office with the complaints of insomnia that he has been experiencing for past 2 weeks. An inquiry, Mr. Chu
Can you,
informs you that he
excuse me, sorry, Dr. Humaira. Is everyone listening to Dr. Humaira?
Yes, ma'am.
Yes.
we can.
Okay. So, first, Dr. Humaira will read
Sorry to disturb you.
scenario. After reading this,
sorry to disturb you. Is the Dr. Humaira is
Ji, sir.
is the chairperson, is it?
No, sir.
Dr.
Dr. Saima is the chairperson.
No, sir. I am the chairperson.
Right. So, and you have asked Dr. Humaira to read the trigger.
Ji, sir. I have asked every one of the group member, but Dr. Humaira has voluntarily said that she will read out the scenario for everyone.
Okay. Thank you. Thank you. Sorry to bother you. Yeah. Please continue.
No problem. Thank you, sir.
Okay, I'll read again. Mr. Chu, a 56-year-old businessman, comes to your office with the complaints of insomnia that he has been experienced from past 2 weeks. On inquiry, Mr. Chu informs that he has been taking ginseng capsule 4 times a day for past 2 months and was initially feeling much more energetic in his work. However, fatigue has started to kick in the following the aggravating insomnia for past 2 weeks. Thank you.
Is the scenario clear to everyone? Dr. Amna, Dr. Zia, Dr. Mavish, and Dr. Sadaf.
Yes.
Now, what we need to do is, Dr. Kabir, please be attentive. Now, you are the scriber of our group. You need to. We all will collect the different terms from this figure that are difficult to us. Okay, and we are going to write down these difficult terms, and we will find out the meaning of these terms. And Dr. Kabir, as a scriber, you are going to write these all terms on a notebook or whiteboard or Word document, whatever is feasible to you. Then we will represent this scenario or whatever the file that we are going to prepare. We will represent this file to our facilitator. Is that clear to everyone?
Yeah, I better.
Yes.
Okay.
Yes, Dr. Saima.
Please share the terms or words that you find difficult in this scenario.
For me, insomnia first.
Can you?
No,
excuse
the
me,
definition of the
I or complications with insomnia. That is
Yes.
the main one.
Yes, sir.
And
You have
energetic in his work. However, fatigue has started to kick in following the aggravating insomnia for the past 2 weeks.
Okay, please point out your difficult words one by one.
Insomnia, the first one I think is insomnia.
Okay, please write down the insomnia.
Ginseng capsules.
Yes.
And the second one is ginseng capsule.
Third one would be the fatigue.
Okay, wait. Let us
Okay, the
remember
first
your
one is
word.
insomnia.
Insomnia. Second one is
Ginseng. Then
third
fatigue.
one. Fatigue. Anyone else?
Aggravating.
Participation needs from other members of the group as well.
Okay, aggravating then.
I think that's all. Somebody else has any idea?
Any difficult words from anybody else?
Can we proceed?
So should we proceed further or not?
Yes.
We should proceed with it without wasting time.
Okay. Do you have any idea about insomnia? Can anyone tell us about insomnia?
Difficulty in sleeping.
Yes. Lack of sleep, difficulty in sleep.
Difficulty to fall asleep.
Okay, very good.
Should I write this?
Okay.
Ma'am, why don't you make a table type?
Okay. टेबल तो इसे बनाना मुश्किल हो
होना
जाएगा
मैम वर्ड में ऑप्शन जो है
व्हाइट
मैडम
बोर्ड
इसके सामने ही लिखे हैं।
हाँ व्हाइट बोर्ड है आपका तो
difficulty in sleeping. Okay.
Mm.
And then ginseng capsule.
Okay.
I think it's a herbal supplement.
Chinese traditional medicine.
Looks like it's over the counter medication.
We need to see that what is it used for? Used for?
Am I right?
At this point, do we need to see that what it is used for? The ginseng capsule?
मैम आप पे डिपेंड करता है कि आप मतलब अपनी लर्निंग नीड्स के आपको ठीक लगता है कि नहीं
ठीक है सही है तो बाकी सबका क्या ख्याल है इसको देखना चाहिए कि नहीं
ये सब है यहाँ पे
मैडम
कंटेंट्स वगैरह हमें देखने चाहिए.
Sorry, madam, some of our participants are from other countries and they may not understand Urdu.
Oh, okay.
Yeah, please use the English language.
All right.
Yeah.
Sorry, sir.
Well, the logic here of using ginseng is it is usually used as a geriatric medicine. So the guy is quite old. He's a 56-year-old businessman.
Easily advisable, right?
Or stays
Uh,
One is hard
asleep.
to sleep.
Or
no?
staying
Sir,
asleep.
Yes, stay asleep.
They are not able
excuse,
to stay asleep.
excuse me, I have a question from all the group members. Please clear me that do we have to write the meaning of these difficult terms in the facts and ideas or in the learning needs? I'm not clear about that. Please.
Ma'am, I just wanted to add that we should write the meaning in front of these words under the column difficult terms.
Actually, if you have already figured out the meaning and you have understood it, the whole
Okay.
group, then it's no need to have learning need.
Okay, sir.
So, if something is not clear and it has not been clarified, then that you can put in the learning need.
Okay. Thank you, sir. Thank you. Okay, now explanation to the facts or hypothesis. As a Mr. Chu is a 56-year-old businessman. I think explanation to insomnia is the age factor, maybe, and of course he's a businessman.
Occupational.
Occupational, of course.
Sorry to interrupt, but I think the facts and ideas are all the facts that are in the paragraph. Like, for example, Mr. A 56-year-old is a fact, being a businessman is a fact. I
all
think facts and ideas contain
But
this.
but that could be the explanation of the fact, I guess.
Yes.
Listen.
Excuse me, for example, the fact is that he is a businessman, and
Yes.
then the hypothesis could be whether some business problems are the reason for his insomnia. So
Okay.
that's how you drive a hypothesis from a fact.
Yes, sir. Okay, thank you. So that means we are going to explain or hypothesize this into the next bar, that is explanation of facts, such as insomnia. So in the explanation or hypothesis, we can write one of the fact is the age factor. The other is businessman. He's old man, is doing business, some business problems or overworking or maybe some thing that is related to business is bothering to him that can lead to insomnia.
I'll repeat them one by one. Basically, with Asian ginseng, you get nervousness. This is the side effect, common side effect. Insomnia, changes in blood pressure, diarrhea, and mania sometimes. In severe cases, it can lead to mania.
Insomnia, changes in BP.
Changes in BP, nervousness,
Okay, and then
vomiting or diarrhea, and in severe cases, it can lead to mania as well.
Okay. But someone just mentioned about
Dr. Tanveer, you are making life easy for everybody.
Well, sir, that's what I do.
Yeah, okay, thank you. Yeah, but uh, the obviously we are not dealing with undergraduate students, so for
Yeah.
them these would be the really learning needs.
Okay. So one learning need would also be the like someone just mentioned the dosage of ginseng. Like
Can
what is the dosage of
anyone please tell us
The
what
dosage, the
is
side
the
effects
possible
of medication.
duration of taking this medication? Like he's taking it for 2 months, but what is the recommended?
yeah, exactly. So one learning need would be the dosage, the timing, and the side effects.
May I share one hypothesis?
Mm-hmm.
He's a businessman. Can there be some business problems which are creating insomnia in him?
Mm.
Yeah,
There
that can be
person.
one hypothesis.
Okay.
Yes.
Some of the group members are not participating actively, and you all are requested to participate. Any comments from Dr. Spark, Dr. Ismail, Dr. Natasha?
Depression could also be one of the causes.
Yeah. But again, stress in work would lead to that. So stress in work would lead to that, and then maybe there is depression, and that's why there is this aggravating insomnia and all these things. So again, it's related to the stress. You can just add it maybe over here. Okay, what else?
Due to excessive work, has his daily routine been disturbed?
Mm-hmm. So anything else?
Yes, I want to add. I think we should also know for how long is it safe to take ginseng capsules to avoid the toxicity?
Yeah, I have mentioned that in the learning needs, dosage, timings, and side effects.
Okay. That's it.
Do we really know what is ginseng?
Yes, so we
Or
identified that over
or
here.
Chinese traditional medicine. It's a herbal supplement.
This was one of our difficult words, so
all right, okay, thank you. Yeah.
It is extracted from the roots of a particular plant.
Yes, I mean, if we don't know, that can become a learning need to learn about the ginseng, what it is and what are the constituents.
Side effects of ginseng have also been mentioned.
Yeah,
in the
I
learning
mean, what are the pharmacological active agents that can,
Contents.
yeah,
Yes.
content, yeah, that can be one of the learning needs.
more active or more dynamic in recent time, we would call it
Okay.
more energetic. So
Okay.
become more active, become more dynamic, become more industrious or lively, like these different terms can be used for it. But like a person is more active, more lively, more aggressive, more dynamic, more industrious than he previously is. So we will call it more energetic, like as compared to his normal vigor and more like his normal lifestyle. He has become more active, more you can say dynamic, aggressive. In recent time, matlab, there is some change in his behavior in respect to his normal, so we will call it more energetic. I
Thank
think
you,
this
sir.
is my
Thank you, sir. And so, Dr. Kabir, I think we should move on to the discussion point in front of insomnia. We should write down the meaning of insomnia, and then we should move on to the facts one by one with the help of our group members. In the discussion points, please write down its definition. Yes, that's fine. The fact and ideas could be
Age.
in age, exactly. Thank you, Dr. Humera. Age,
Occupation.
the occupation,
Occupation.
yes. In the facts we can write down the age, occupation.
No, first one I want to write down the drugs, because the long-term effect of the insomnia, I mean ginseng capsules, the adverse effects, long-term effects.
Yeah, that could
He has been
that
used
could
2 times. So the long-term,
all three facts
understand?
could be written. All three facts could be written.
Okay.
The medicines
No,
that he is taking.
excuse me. Actually, what you are talking about is the explanation why this patient has insomnia.
Yes.
Yeah, so those are your hypotheses, not the facts. So that, let's say, whether age is the cause or occupation is the cause or ginseng is the cause, is your hypothesis. That should be under the column of hypothesis, because that's what you think is the likely cause.
Yes, sir.
The facts you have, let's say, is the let's say 56 years old businessman and taking drugs. Those would be the facts. But the reason for insomnia is it could be your explanation. Yeah.
Okay, sir. Okay, sir. Thank you. Okay, Dr. Kabir, so we need to write down in the facts column the age, that is 56-year-old. No, and that was fine.
This should be in the facts and ideas. This should be in the facts and ideas.
Yes.
The 56-year-old is a fact, so it should be in the facts. Yeah.
Yeah, another point is the dosage of the drug actually. That patient is taking 4 times a day.
Exactly. But first, excuse me, please listen to me carefully. In the facts and ideas column, we are going to write down just the age. That means that we have been provided, that is 56-year-old. Okay. The occupation, that is a sedentary worker and a businessman. Okay. Along with the sedentary worker, we can write down the businessman. Okay. In the drugs column, the fact could be that ginseng capsule, we would write it down. In the explanation of the ginseng capsule, we will write it down that it is a stimulatory drug or taken for the boost your energy, and that would be the hypothesis that this drug could be the cause of insomnia. And as he's taking this drug in 4 capsules per day, that is the very high dose of the drug that we can write down in the hypothesis. In the fact and idea, just write down the age, sedentary worker or businessman. The fact that could lead to insomnia is obviously taking the ginseng capsule for more than this duration. And the
I have already written, just to just see if we anything.
Ji sir, you are doing very good job. Now move on to the explanation of the fact. 56-year-old, that is a age factor because of old age. Old age is one of the factor that could lead to these two insomnia in this patient. Occupation means there must be some, or there could be some business related problem that
Sedentary and okay, anxiety, occupation.
but
Okay,
sir, I don't think the sedentary worker can be related to insomnia. It's a type of work, maybe, whether it could be the sedentary work or it could be the moving work, whatever, all can lead to the, anxiety could be the factor that could be related to his occupation.
So
Now
this
in
should
the
be, anxiety and stress should be put in the explanation column, not in the fixed column.
G sir, exactly. Dr.
And
Kabir?
and also about more than 2 months in high doses.
Yes, that could be also shifted to the hypothesis.
Yeah.
Do you get that, Dr. Kabir?
No, please come again, please.
The anxiety and stress, you can move this words into the explanation of facts or hypothesis column in front of occupation.
Yeah.
So under the occupation, we can put it, right? Under the occupation.
Yes, sir.
Sorry, anxiety.
Yes,
Sorry to
that's fine.
interrupt, but you guys are doing very good. Only the few members are participating. The other participants are totally quiet. Chairperson, I request you to involve them as well.
Now,
it is quite a norm, right? There is quiet student, there are very active student in the class, so you cannot change the nature.
okay, let's move on to the fatigue. The fatigue means the extreme tiredness that results from the mental or physical illness or exertion. The fact to the fatigue. Dr. Humaira.
Dr. Sama, we need to move more than 2 months and high doses or also into hypothesis on the drug.
Assalamu alaikum, sir.
Ashfaq Saab.
Sir, I was in the group one, but mistakenly there was some problem, so I left out. So put me in the group one, sir, please.
Okay, thank you. Done already. you can join the group 1. हाँ, किसी भी एक ग्रुप में जिसमें कम लोग हैं.
Capsule, taking ginseng capsule 4 times a day, and initially he was energetic initially.
Taking 4 times a day for 2 months, but started feeling fatigue for last 2 weeks.
Insomnia and fatigue.
Yes.
I think we have to explain the hypothesis as well. Explanation.
Dr. Maya is saying hypothesis has to be framed into a statement, not as phrases.
As a statement. So I was going to explain that. So I think we can write, okay, we can write that as an explanation.
Okay, there is a statement in the chat box, such as Mr. Chu, a 56-year-old businessman, has been experiencing insomnia, which is worsening despite taking ginseng, which could be because of stress.
No, but we have multiple hypotheses. In one hypothesis, we have said that it may be due to side effects of taking ginseng, the fatigue and the insomnia. And okay, so how can we improve on that?
We can include a chronic overdose in it. Chronic overdose of ginseng.
May be experiencing the fatigue and insomnia due to side effects or chronic overdosing of ginseng.
The scenario says that fatigue was due to aggravating insomnia. And insomnia might be due to ginseng.
I concur.
Okay. The fatigue was due to insomnia, and the insomnia might be due to ginseng.
The side effects of yes, ginseng.
Ginseng and the fatigue may be a result of insomnia.
Yes, aggravating insomnia.
Is this fine now?
Yes.
Yes.
Okay. And then the alternative hypothesis will be due to the
stress in work.
Increasing stress due to because of nature of the job.
It can be due to his old age as well.
It's not that much old. Dr. Tanveer is just 56 years old. Not like he's 86 years old.
I have a
And
question.
mine-
Significance of gender in this.
The life starts at 56 years of age.
Especially for businessmen.
Yeah.
So,
I would say that would be starting for physicians, I think. It ends at 56 for surgeons.
okay, so what about the dietary causes? How are we going to write that in hypothesis? There might be Because nothing about the diet was mentioned in the
Trigger.
yeah.
I think it should be in our learning needs how diet affects taking consumption of ginseng capsules or the other way around.
Some diet may interact with ginseng, so maybe that could be the cause as well. It's the effects of diet on taking ginseng.
Well, ginseng is basically an homeopathic medicine, so it is very difficult to regulate its quality and its quantity.
Is it FDA approved?
Yes, I just checked.
So do we not need to add anything else, because I think it's 5 minutes to go.
I think I wanted to ask, is there any significance of gender in this particular case? Like, by any means?
Are you suggesting that the insomnia can be more in one particular gender than the other one?
No,
Are you getting at that?
I mean, it's a drug for all things. If you have any disease, it will cure you. If you don't have any disease, still you can take it. It will prevent from all kind of disease.
One suggestion, the facts, ginseng capsule about the facts and ideas. We should only be knowing about the amount of ginseng capsules and the duration for which he is taking. The rest of the headache, diarrhea, and whatever side effect, it should be in the explanation hypothesis. One of the side effect of this is that high ginseng can make you restless and cause uh, additional sleep problems. It can cause blood clotting disorders. It can even lead you to schizophrenia if it is taken in high dosage.
Dosage.
Yeah,
Please write
it
down
can increase
dosage.
your blood pressure. These should be in these schizophrenia, tachycardia, etc. These are facts and ideas. I think facts and ideas. We should mention those things which are known to us in the
In the
history of the country.
scenario, yes,
Yeah,
sir. The facts and ideas that are mentioned in the scenario, that are what we are going to note it down in the fact that these headache, diarrhea, tachycardia, schizophrenia, bleeding diastasis,
yeah.
these we have known by reading further. Okay, so we can put these down into the learning niche. Right now, we are just going to put it down the insomnia could be the fact for taking like ginseng capsule in the explanation or the hypothesis. Just we are writing down the indication of use that he was getting fatigue and he wants to boost his energy, and the duration for which he was 2 weeks. I think he is taking ginseng capsule. The dosage is the important hypothesis
Yeah.
in our scenario that he is
Dosage and
taking.
duration. Dosage
Yes,
and duration. And I
yes,
think
yes.
there are many good effects and bad effects, yeah, side effects of the ginseng capsule. We do not to include all them in this discussion, like diarrhea and bleeding death. These may be the side effects of ginseng capsule,
Yes,
but
that
as it is not relevant to this case scenario, So we may not need to mention
Ji,
all
sir.
those.
Yes, sir, I agree with you.
Yeah.
So the facts and ideas about ginseng capsule would be, he's taking ginseng capsules 4 times a day from the past 2 months.
Yeah, this is,
Initially, his energy levels were increased, but
yeah,
from the past 2 weeks, he's feeling fatigued and he's experiencing insomnia.
yeah, this is the effects and idea.
Yes.
Wait, I'm writing down.
Ginseng capsule dose and duration go up. You can mention those. Ginseng capsule for mention the dose and mention the.
Sir, please hurry up. It was nice meeting you all. Thank you. If you mind anything from my side, and sorry in advance. We are running short of time.
Okay.
Thank you, Dr. Kabir. You have been a nice help. Thank
Who
you,
is-
everyone.
Who will be presenting? Who will be
Yeah,
presenting?
yeah. I think you will
Well
be
done, group.
presenting.
You guys did amazing job, and I hope all the terms are clear to all the participants, and all the best for your presentation. I think you guys have
I
covered.
think this
Have we joined the main session? Where are we?
Yes,
Yes, sir.
in the main session.
You are in.
We are in the main session.
We're Alice in Wonderland.
Yeah, after going through the ginseng story, yeah, you can be anywhere.
Yeah, I'm starting to feel like that.
Right. We will wait for everybody to join, and then we'll go through one by one the experience of every group. Not only looking at the learning needs, but what problems did you face? Welcome back, everybody. Thank you. I hope you had I hope you had a good discussion and good experience. And this is the time that we would really like to know your feelings, and if you had any issues or any problems, then we will discuss one by one. Can we start with the room 1, the scribe of room 1?
Yes, sir.
Yes. So you can share the learning needs, or you can also share other issues. The chairperson of this group or other members as well. Everybody is welcome to contribute if there is something important which you think should be shared. Yes, please.
So the learning needs that we identified as a group were the side effects of ginseng. We should know about the side effects of ginseng because that might be related to the trigger. Then the dosage of ginseng, in what dosage it should be taken, required time to take ginseng because the person was taking it 4 times a day. And then the uses of ginseng, what is it used for? And active ingredient in ginseng, what is the active ingredient in ginseng, and what are generally the causes of fatigue? Because the cause may not be related to ginseng itself, the medicine itself, and then the exacerbating and relieving factors of fatigue, effects of diet on taking this capsule, whether something in the diet, if it is taken with the ginseng capsule, that might lead to the effects that this person was experiencing, and then gender role in the side effects of ginseng, whether ginseng affects, whether there is any difference in the side effects in one gender, male or the female. So these are the learning needs that we identified.
Okay, thank you, Dr. Bushra. Is any other member of the group want to say anything? Did you face any problem, any challenges?
Hello, can you hear me, sir?
Yeah, yes, please.
To me, the point of discussion, discussion points is one of the main things, the insomnia, and the causes of insomnia. What are the triggers? What is the factors in this scenario triggering the insomnia? That should be come under the learning needs.
Right. Yes, that's one point. The insomnia is another component. The one thing we should realize that all the groups may not come up with the same learning needs, but the learning needs which have been mentioned in the PBL package are facilitator guide, and facilitators know about it. So if insomnia is mentioned there, the facilitator has to tactfully bring that issue in the discussion. If facilitator feels that is a learning need and it's missing in the discussion, so he or she may not directly say that's the learning need, but can bring the issue in discussion. So that is usually dealt with by the facilitator, that if learning needs are missing, the facilitator would introduce it in indirect ways. So Dr. Kabir thinks that insomnia is an important issue that is really the problem of Mr. Chu. So that should be addressed in the learning needs. Okay, that's one point. Any other point?
Yes, sir, I have one point.
Yes.
In learning needs, I also want to emphasize on her fatigue. Like Mr. Chu is 56 years old, and maybe he's having fatigue due to his age-related causes. Age.
Right. Yes, Dr. Uzma, thank you for that suggestion. I was in one of the group, and they think that 56 years is not an old age. That it's a young age. So,
of course, very right.
So they thought that should not be a problem.
Okay, sir.
Yeah.
Just the thought of making yourself feel good.
No, it's just not a thought. It's the practical. Right? Any other points, please? The members of the group, do you feel it's a sort of self-assessment or self-reflection? Do you feel that you have contributed enough, or you could have done a bit more? And is everybody satisfied in the group by your contribution?
I am satisfied.
Yeah, I saw you. Yeah. Right? Okay, now let me put it in other way. do you feel that you were like a dominant person in the group?
Maybe.
So there were some members of the group that everybody was contributing, but like yes, a few people were dominating.
Yeah, so it's just a self reflection. The whether how we can improve our contribution in the group. I mean, if you have a point but you wait for others to contribute, and if nobody has mentioned that, then of course you can mention that. So, but then you would not be a dominating person.
So
but
few of
if-
them didn't even try to matlab,
sorry,
give their input.
yeah. So that's the forgotten student. What I'm saying is that if you feel that you are not giving opportunity to others to contribute and you are too fast to respond, so there may be some element of dominance in that. So
Sir, I have a question.
Yes.
So what is the role of facilitator? Can the facilitator intervene at that time if they feel that the group is like some people are getting dominating and others are not responding?
No, usually not at that time. Usually the facilitator can call the student later on and counsel. But basically the chairperson should take the role and should say, okay, let other people contribute. And chairperson can also pick up the student who is not taking part, so ask them to contribute. Is the facilitator would not intervene at that time. Mainly it would be the chairperson.
I think the students, the participants have missed that part of the learning the difficult words.
We have mentioned those in the start.
And no, but they have listed the difficult words, but they didn't find the meaning of the difficult words.
I'm here is the
Yes, ma'am, it is written in front of them.
And they have written it as an explanation.
Okay. But actually we meant meaning. It's actually the meaning of these difficult words.
Difficult words, yes. So you needed what does the word difficult sleep is not the meaning of the insomnia.
Insomnia, yes.
Is the inability to sleep for how long is insomnia.
Okay. Thank you, ma'am.
And another thing is regarding that dominating students, if the other group members are not talking, then that person will look like he or she is dominating. If
That's
all
what the dilemma was.
I'm on your side, Tanveer. If the group is proactive and the one person still dominates it, then that means he's not allowing other people to talk to. Tanveer could have helped the other members to contribute indirectly. Tanveer, you can help the group.
Dr. Tanveer, we are taking your name because you have mentioned yourself. I think that's a good gesture.
Question is that the students who dominate are good students, and they cannot keep quiet and wait for the answer of the other people, which is sort of a bad thing. But if other people are not talking, then the one way is that you can ask your friend that, okay, you give some input. Anybody can ask that if the chairperson is not asking that question. And normally it is the function of the chairperson to intervene over there. But then you can prompt other people to give your input. All of them are your friends. You can ask anybody. Okay, so it will make your teamwork much better. You will emerge as a good team.
Noted, ma'am.
Right. Anybody in this group did you find any problem or any issue which you think we need to discuss?
Sir, I have a question regarding the difficult words here.
Right.
You see, we are concerning with medical education. So the medical terminology, medical terms, and medical, it should be focused. So you see, fatigue, ginseng, insomnia, compared to all these three words, aggravating, how could be difficult words? Aggravating is a word that phrasing the scenario, that there's some things aggravated or something. So I'm a bit confused. How come aggravating would come under difficult words compared to the fatigue, ginseng, and the insomnia?
Yeah, Dr. Kabir, one is the medical terms. Other may be simple English words which are necessary to understand the problem. If, for example, somebody does not understand what is meant by word aggravating, they would not understand the problem. So when we say difficult words, it's not only the medical terms, but other English words as well, because the purpose is to comprehend the problem. If some word is so crucial to understand the problem, that should be clarified. Okay, can we move on to group 2? Thank you very much, room 1. You have done a wonderful job. Can we move on to room 2, please? You can share the screen.
Room 2, are we in the room 2?
Yes, sir. Dr. Kabir, yes, you are in room.
Yeah, Dr. Kabir, you were scribe in room 2.
Okay, just a minute.
You can share the screen.
Are you able to see?
Yes.
Okay, I would request our group captain to discuss this one.
Okay. I'm Dr. Saima Latif Qureshi from Islamabad, Pakistan. So from this scenario, we have written down the difficult terms and the meaning of difficult terms, to which we have given the heading of discussion points. Under the facts and ideas, we have tried to write down the facts of the difficult terms that are provided in this scenario. Under the column of explanation or hypothesis, we have tried to hypothesize the causes of the difficult terms that could be the possibilities in this scenario, and the learning needs that we need to learn in the next session or beyond this time. Okay. So in the difficult terms, we have write down the insomnia. The meaning of insomnia, that is the sleep disorder, that if a person feels hard to sleep or sleeping not well or difficult in falling asleep and staying in sleep. The fact and idea for the insomnia in this scenario would be the 56-year-old sedentary worker or the businessman, and the medicine that he is taking, that is ginseng capsule. And the explanation or hypothesis of the insomnia is again the age, that is 56-year-old. Occupation of the person or the patient that is coming to us. The business-related anxiety or stress could be the cause of insomnia in this specific scenario. Under the fact of this medicine that he is taking, the hypothesis for this medicine could be the dosage and the duration of this ginseng capsule, for which he is for the time duration that he is taking these capsules, or for this boosting of his energy. And the learning needs would be the further, like definition we have already tried to write down in the simple words, but if we need to learn it further, we can learn it in the next session, the other causes of insomnia and the complications of insomnia that we can learn in the next session. Under the difficult term, our second term is the fatigue that we have explained it, that is extreme tiredness that results from the mental or physical illness or exertion. The fact for the fatigue could be job-related stress and anxiety, the workload that he is facing, or and the lack of sleep. He is having the insomnia for 2 weeks. And the explanation or hypothesis for the fatigue is that he is a businessman, though, so the job-related stress and anxiety could also lead to the fatigue, and the time management for the duration for which he is working. As businessman, he might is working for more than 8 hours or more than 12 hours or more than 16 hours. That could also lead to the fatigue. So the third difficult term is the ginseng capsule. The meaning or the discussion for the ginseng capsule, it is a supplement that is used to improve the health and boost up the immune response, and it is a popular supplement that is taken in the neurodegenerative diseases, and also it is a popular supplement that is used by a person to boost up the energy and the immune systems normally, not only in neurodegenerative diseases. The facts are the ginseng capsule, as he is using for more than 2 months, and the dosage is important, that he is taking 4 times a day. The explanation is the indication of use that he is feeling fatigued, that's why maybe he is using ginseng capsule. The duration of using these capsule and the dosage, of course, that he is taking 4 times a day, that could be the cause of the problem that he is coming to us. The other adverse effects of the ginseng capsule are these that are mentioned, and the indication and further adverse effects that we could learn in the next session. Thank you, everyone.
Okay,
Thank
thank
you,
you.
Doctor.
Thank you very much. If we look at your table, you have modified this table. You have
Yes.
added the discussion point right after the difficult terms.
Ma'am.
That makes the facts and ideas and explanation of facts and ideas a bit confusing when you are going to talk about them in the later part. Okay. So in the difficult parts, insomnia, the meaning of the insomnia will come under the insomnia, and the meaning of the fatigue will come under the fatigue.
Okay.
Regarding the ginseng capsules, you have given the whole function of the ginseng capsule because you have given the heading over there. You just have to mention what is ginseng capsule and where it is derived from. That is the only thing which you will get from the Google. It is a drug which is derived from the plant, the name of the plant, and it is the function of it will come later on in the discussion.
Okay.
So when you will be talking about the facts and ideas, you will discuss over there why they were using ginseng and what are the functions of the ginseng.
Okay.
And whether they were taking it in an overdose or not, and if it was overdose, then what are the side effects of that?
Okay, ma'am.
Okay, and because of that, you will create your hypothesis that probably this guy was increasing the dose of the ginseng, and if you look for the ginseng, it has a lot of information about the ginseng you will find in Google. Okay. And the first and the most important thing you have missed in your facts and ideas is the name of the Mr. Chu.
Oh, okay.
It's very important to know the name, because it will help you to see what these people from different countries they use.
I didn't get the last point, madam. What did you say? I couldn't.
Mr. Chu, the name was not added in the facts and ideas. It should come number 1 in the list of facts and ideas. When you're putting down facts and ideas, it should follow exactly the trigger from which you are taking it. Only then you will get the flow of the things. Okay.
Okay.
So Mr. Chu, a 56-year-old man. Now you have to think, is the name important and if the age is important or not? Okay, so he's a Chinese guy, then you have to look for the probably ginseng is one thing which is used by the Chinese more because you don't know about anything about ginseng. Yes?
Okay.
Okay, then you will go for the occupation. Occupation, you have to mention in the facts and ideas that his occupation is not a sedentary worker, he's a businessman. He might be
Yes.
running all day along.
Yes.
Yes,
Oh, madam, actually, the businessmen usually, they are on a daily labor work. Why I put in the sedentary work? Because usually businessmen, their work is clerical. I mean, in job desk. Okay, they give the decision.
No.
Physical activity is less there. So patient having physical activity, they are suffering more. Insomnia.
It can be one explanation, no problem.
Yeah.
But normally a businessman might be the one who is running around all the time as well.
That depends upon the type.
That depends upon the type of business they are doing.
Okay.
Okay. So because when you call it a sedentary, that means that you are thinking of something else over there. Sedentary habits might be having a heart problem now. Is having goes on another diameter. Okay. The ginseng capsules, then you have to think about the dosage of the ginseng. What is the normal dosage of the ginseng? So when you get it, what are the side effects of
Madam,
ginseng? What is the composition of the ginseng? Yes, Prof. Kabir.
No, we ran out of time. They are in the learning.
It's okay.
We're supposed to write it down. So, but we ran out.
Yeah, it's okay.
Okay.
It's okay. I think there was some confusion with the grouping as well. No? So it doesn't matter.
No, ma'am. I think that's how we learn by
Yes,
mistake
definitely.
and by practicing. We learn first.
There is no mistake, Saima. This is just a learning process. In the
Yes,
learning process,
exactly.
yes, we will learn. No problem with that.
Yes, exactly. Thank you, ma'am.
You see, the focus of this exercise is to understand the flow, understand the discussion we are doing on ginseng is just an interesting point that we are discussing. But actual purpose of this whole exercise is to become familiar with the process. So even if you have not picked up all the learning needs, or if there are other things there, it doesn't matter actually, because our focus is the process, whether we understand the process. Now, okay, anybody in this group has any additional point in terms of flow, or was there any disruption, or your own role? Anybody want to share?
So can I
Reflection,
speak on some,
self-assessment?
about the scenario, sir? Sir, regarding the scenario, can I raise some points, sir?
I was in this group for the initial period. Probably Prof. Malik missed that. Am I heard?
Yeah, man. I can hear you.
Okay, I was in this group too for initial period, and I think the very good work which was done was the introduction of the all the members. The facilitator did very well over there, and she asked for the name of everybody, and then everybody introduced themselves, and then she asked them to read the trigger, and then they read the trigger, and then she has asked them to get the chairperson and the scribe also selected. So the flow was very nicely done by the facilitator at that stage. And after that, the discussion started off very well. The only thing is that there was some confusion on the length and the breadth of the PBL trigger, that it was not adequate enough to think too much about. Thank you.
Thank you, ma'am. Thank you, sir.
Thank you, madam.
Thank you, ma'am.
By
Thank you, ma'am. Thank
by
you.
hearing that, I might think that you might have made some new friends.
Yeah,
And,
definitely.
Of course.
please
Yes,
keep in
Of
touch
course.
some
even after
international
this.
Such
and
an
national
interactive
friends.
session it was, sir.
Yes.
Yes, sir. I have now many friends from Islamabad.
All right, so keep in touch with your new friends. Can we move on to the next group, please?
Yes, of course.
Yeah, Prof. Kabir, can you stop sharing? Yeah. The
Thank you, sir. Thank you.
Room 3.
Dr. Noman, share your screen.
So I hope you are seeing this.
Yes. Yes.
Okay. Bismillah ar-Rahman ar-Rahim. So the difficult terms in the trigger number one was insomnia, ginseng, fatigue, aggravation, and kick-in. So these were the difficult terms which were discussed by the group members. And the definitions were, of course, being highlighted in front of each of the difficult terms. Insomnia being difficulty in falling asleep, ginseng, a herbal medication, fatigue, feeling tired, aggravation is in increasing intensity of the same symptoms, kick in to come in about. The effects and ideas to our trigger, which were discussed in the group, were Mr. Cho, a 56-year-old businessman, experiencing insomnia for the past 2 weeks, taking ginseng capsules 4 times a day for the past 2 months, feeling more energetic. Fatigue started to kick in afterwards, which later on aggravated insomnia for the past 2 weeks. So these were the facts that were described, that were discussed by the members in the trigger. An explanation of the facts and hypothesis. Number one is age factor, stressful occupation, trouble falling or staying asleep, or good quality of sleep, recent episode, self-medication, a herbal medication, overdosage of ginseng. Now, learning needs to our trigger were the description of normal sleep cycle. Please pardon the numberings that were given in this, because it starts from 1, not 10. What are the age and occupational factors related to insomnia? What is insomnia and its types? Causes of insomnia, treatment of insomnia, what is ginseng capsules, dosage and its health benefits, what is the mechanism of action of ginseng and its side effects, relationship of fatigue, insomnia, and being energetic, or the energy levels that were according to the trigger, and what is fatigue and its causes. So these were discussed by the group members.
Right. Thank you very much, Dr. Noman. I think that was a very neat presentation, and you have conveyed the things very, very clearly.
Thank you, sir.
In a very systematic manner. Can I open this presentation to everybody for your comments?
Sure, sir. Sure, sir. It has been shared on the screen, so
Yeah. So anybody want to comment on that? But please keep in mind that our main focus is the process and the understanding. Yeah. Any of the group member want to share anything about the flow and the working of the group? Yes, Mavish Javed. Yes, please.
Yes, sir,
Sir,
it was a very good.
very good experience. People from different like domains, different specialties were there, so we had a different perspective of the same scenario, and it was very helpful in that case.
Right. Thank you. Thank you. Anybody? Any other comment?
It was a wonderful experience,
Who
and we have learned.
yeah. Who was the facilitator?
Dr. Uzma.
A lot, and we have practically
Dr. Uzma.
done this
Dr.
drill, and
Uzma.
we have learned how to conduct.
Dr. Uzma, Uzma Siddiq, you were the facilitator.
Yes, sir.
Did you find the participants helpful?
Yes, sir. They were interacting with each other, and especially from different specialties, they were interacting and they were sharing their experience as well. And the scribe and chairperson, they both worked very well. They helped and they asked other participants to participate.
Did you feel at any point that you need to intervene?
I just intervened at one point when a few of the participants were quiet, but then the chairperson asked them to speak it up, and the other participants then interact, and they helped the scribe in adding points.
So you got a positive response to that?
Yes, sir.
Oh, great.
It was a good group
Okay.
interaction.
Yeah. Any other point from the other groups, other participants of this workshop want to comment on? Now, if we see that obviously we have done not the complete process of PBL. This is the first session, and we have identified the learning needs. So, usually would be that after this session, the students, they would learn about the learning needs, maybe individually or in groups, and maybe they would be the must learning needs are good to know the needs. And then they meet again, maybe a few days later, and then they discuss what they have learned, right? Okay, can we move on to the room 4, please? Yes, room 4, please.
Okay. Can we have the feedback from the facilitator?
Ji, Assalamu alaikum, ma'am. I'm Dr. Munazza. I facilitated this group 4, and all the at least I tried all the participants should participate and get to understand what the scenario is and come up with the facts and ideas and explanations, and then the learning needs. Dr. Khatija was the scribe, so she's gonna explain how did this go.
Okay. Assalamu alaikum. I'm Dr. Khatija. Yes.
Before scribe, can we have a chat with the leader? Chairperson?
Yes, ma'am. I'm Dr. Usma. I'm the chairperson in this group.
Okay, Usma. How did you think you managed the group?
I think I managed the group in a good way. In basically, in one step, the facilitator told me to ask the group members that are quiet to facilitate them in the learning process. And then the other group members work very well, and all are participated in the group quite easily.
Mm-hmm. Was there any dominant member in your group?
No, not really. All are equally participated in the group.
But probably the facilitator mentioned 3 girls, no, who were not participating.
Okay.
Yeah. Were they participating after that?
No, I think
After
yes, they participated after that. After nominating their names by the facilitators, then they participate.
Good. That is good. And the scribe? Can we get the scribe now?
Yes, yes, ma'am. Yes, ma'am.
Okay, Khadija.
Okay, ma'am. First of all, we identified the difficult words: insomnia, ginseng capsule, aggravating factor, and fatigue. Then, seeing on our basis was these difficult terms. Then we came to the fact and ideas that basically insomnia is a lack of sleep, and this may be and this ginseng capsule. Actually, these are the meanings that we have put it here. The ginseng capsule is some kind of medicine or dietary supplement, and aggravating factor is what is increasing the increase, and fatigue mean extreme tiredness. But the fact was that insomnia is age related and insomnia is job related. These were the two facts that we have concluded from the scenario. Then coming to the explanation, we have concluded that because of some other medication, maybe insomnia is caused. Maybe insomnia is a side effect of the medicine that he is taking, and because the patient is a businessman, so he might got the stress-related insomnia. Then we made a hypothesis that because of ginseng, the person has insomnia, or we can also say that insomnia is related to the job he is doing. Then coming to the learning outcomes, then learning needs that we have to learn about these things for the next PBL session, before the next PBL session, that how is insomnia caused, what are the relieving and aggravating factor of insomnia, what is the treatment of insomnia, how does ginseng affect insomnia, what are the uses of ginseng capsules, and how much ginseng capsule is consumed per day, like its dosage should be known, and what is the fatigue, fatigue caused by. These are the learning needs that we have to do before the next session in the PBL.
Okay, great.
Thank you.
Thank you. My only concern would be that you have not put down the facts over there.
Yes, ma'am. Yes, ma'am.
Yeah. The meanings of the words will be the difficult words, and their meanings come in the one column, and then you have to put the facts over there, the missing facts, and the facts should be in the order as which they appear in the trigger.
Okay, ma'am.
I emphasize this point very, very much, because when you go into the real trigger with the students, the flow of these facts is such that they are linked with each other. And if you miss one thing over there, the diagnosis might change, or the condition might change, or you will be losing some learning outcomes over there. Okay, so
okay.
in practical situation, writing from the now, Mr. Chu, I have mentioned in one of the comments previously, because this is a different name, and because of the different name, it might have a bearing on the use of the ginseng and like that. Okay.
Yes.
But you don't have to mention the name of everybody over there. Only if it strikes to you that this is a different patient or a different thing is happening, only then it depends on the judgment of the participant, or the judgment of the students as well. Okay, but generally they are good, and they start picking these things very early. So you put the facts and ideas over there, and in the hypothesis you have come up very nicely with the display of the hypothesis, and then the learning needs. Learning needs should not be that much that it is difficult for you to manage them. Okay, so practically you should prioritize those learning needs. This is the must-know learning needs, and this is the good-to-know learning needs.
Okay, ma'am.
Okay, the more related to your course, your module learning outcomes will be your must-know ones, and the one which are to add the spice into the learning, you can make it only as the good-to-know ones. Okay. Because
okay.
if you miss the must-know learning needs, then that means that you are missing one of the learning outcome of your curriculum as well.
Okay, ma'am.
Okay.
Yes.
Thank you.
Okay, thank you very much.
I think the groups have done wonderful. I've been in 3 groups, the 2, 3, and the 4, and they have done wonderful. Thank you.
Thank you, ma'am.
Thank you very much, everybody. We are coming towards the end of our session. In fact, We are already almost 10 minutes over the time. I thank everybody for your participation, for your enthusiasm, and at least we enjoyed it thoroughly. I hope you also did that. And as I said, I hope you have some new friends, new contacts, and we are always available on WhatsApp. If you have any questions which come to your mind later, you can always send a message and we will try to answer as soon as possible. Just keep in mind the time difference. So, at the end, I will wish you best in your profession and your next PBL session. Right? Thank you very much, everybody.
Thank you, sir.
Thank you so much, sir.
Thank you so much, sir.
Thank you,
Thank
sir.
you so much, sir.
Thank you, ma'am. Thank you very much, sir.
Thank you so much, sir.
Assalamu alaikum.
Thank you, sir.
Jazakallah khair a lot, sir.
Thank you very much.
Allah Hafiz, ma'am. Allah
Thank
Hafiz,
you
sir.
very much.
Assalamu alaikum.